Hello, everyone. This is Mike. Welcome back. Today we continue our discussion on cerebrovascular disorders, diagnosis, management, and prevention. We will talk about ischemic cerebrovascular diseases. Today's topic is cerebral infarction, or more commonly known as strokes. First, an overview. 1. A stroke occurs when the blood supply to part of the brain is interrupted or reduced, preventing brain tissue from getting enough oxygen and nutrients. Brain cells begin to die in minutes. 2. They are more frequent than hemorrhage, accounting for 85% of stroke cases. 3. They usually lead to liquefactive necrosis with cyst formation. 4. A stroke is a medical emergency, and prompt treatment is crucial. Early action can reduce brain damage and other complications. And lastly, effective treatment can prevent death and also help prevent disability from stroke. Now, let's talk about the causes of stroke. There are two main causes. One is ischemic stroke due to arterial occlusion, which is the most common. Second is hemorrhagic stroke caused by leaking or bursting of a blood vessel. Now, some people may have a temporary disruption of blood flow to the brain known as transient ischemic attack or TIA. It doesn't cause lasting symptoms. We will discuss this in more detail in the next lesson. Now, let's discuss the cause of stroke in more detail. Ischemic stroke is caused by the following. 1. Thrombosis. 2. Embolism. And 3. Small vessel disease. Thrombosis is usually due most often to atherosclerosis. This leads to ischemic or white infarcts. Meanwhile, embolism is from cardiac mural thrombi, vegetations of vascular obstruction, clumps of tumor cells, bubbles of air, or droplets of fat. They usually lead to hemorrhagic or red infarcts. Lastly, small vessel disease is due to arteriosclerosis, amyloid angiopathy, and others. They're related to hypertension. This usually leads to lacunar infarcts. Some initial research shows that COVID-19 infection may be a possible cause of ischemic stroke, but more study is needed. Now, let's look at the different causes of hemorrhagic stroke. 1. They can be due to uncontrolled high blood pressure. 2. They can also be caused by overtreatment with blood thinners or anticoagulants. The third cause is a rupture of aneurysms, which are bulges and weak spots in the blood vessel walls. Fourth, they can be caused by trauma, such as what happens in a car accident. Fifth, they can be caused by cerebral amyloid angiopathy, which are protein deposits in the blood vessel walls that lead to weakness in those vessel walls. Sixth is an ischemic stroke leading to hemorrhage. And lastly, a less common cause of bleeding in the brain is the rupture of an arteriovenous malformation, which is an abnormal tangle of thin-walled blood vessels in the brain. What are the symptoms of a stroke? It is important to pay particular attention to the time the symptoms began. Some treatment options are more effective when given soon after a stroke begins. Common symptoms include the following. 1. Trouble speaking and understanding what others are saying. This includes confusion, slurred speech, or difficulty understanding speech. 2. Paralysis or numbness of the face, arm, or leg. Sudden numbness may develop, often affecting just one side of the body. Third, problems seeing in one or both eyes. The patient may suddenly have blurred or blackened vision in one or both eyes, or patient may see double. Fourth is headache, a sudden, severe headache which may be accompanied by vomiting, dizziness, or altered consciousness. And lastly, trouble walking. Patient may stumble or lose their balance. They may also have sudden dizziness or a loss of coordination. It is also important to note that actual clinical presentation depends on the site of vascular obstruction and extent of collateral circulation. The common site of occlusions include the following. 1. Thrombotic occlusions, which occurs the carotid bifurcation and middle cerebral artery. And 2. Embolic occlusions, which tend to occur more often in the middle cerebral artery. Strokes results in contralateral paralysis, as well as motor and sensory defects and aphasia. Listed below are clinical presentations depending on the site of vascular obstruction. Clinical presentation resulting from obstruction of the anterior cerebral artery, or ACA, is as follows. 1. Weakness and sensory loss in the contralateral leg. 2. Transient expressive aphasia. And lastly, abulia, or loss of ability to make decisions or act independently. Clinical presentation resulting from obstruction of the middle cerebral artery, or MCA, is as follows. 1. Contralateral hemiplegia of face and arm and case palsy. 2. Contralateral sensory loss. And lastly, aphasia if the dominant hemisphere is affected. Clinical presentation resulting from obstruction of the posterior cerebral artery, or PCA, is as follows. 1. Contralateral hemianopsia, or total cortical blindness if bilateral. 2. Alexia without agraphia. And 3. Thalamic syndrome, or pain hypersensitivity due to damage to the thalamus. Now, other stroke symptoms include 1. Dementia, which is due to recurrent small infarction or small vessel disease. And lastly, lacunar strokes, which is due to obstruction of small vessels that result in small lesions that upon healing are recognizable as lacunae or small pits. Clinical manifestations are usually focal and can be purely sensory or motor. Pure motor lacunar stroke are from lesions that affect the internal capsule. Pure sensory lacunar strokes are from lesions that affect the thalamus. Risk factors for strokes are potentially treatable. First, lifestyle risk factors. They include obesity or being overweight, physical inactivity, heavy or binge drinking, and lastly, the use of illegal drugs such as cocaine and methamphetamine. Meanwhile, medical risk factors include the following. 1. Hypertension or high blood pressure. 2. Cigarette smoking or secondhand smoke exposure. 3. Hypercholesterolemia or high blood cholesterol. 4. Diabetes. 5. Obstructive sleep apnea. 6. Cardiovascular disease including heart failure, heart defects, myocarditis, or arrhythmias such as atrial fibrillation. 7. Personal or family history of stroke, heart attacks, or transient ischemic attack. And lastly, COVID-19 infections. Other risk factors for stroke includes 1. Age. People aged 55 years or older have a higher risk of stroke than do younger people. 2. Sex. Men have a higher risk of stroke than women. Women are usually older when they have strokes, and they are more likely to die of strokes than are men. And lastly, hormones. Use of birth control pills or hormone therapies that include estrogen increases the risk. Now, let's talk about complications of a stroke. A stroke can sometimes cause temporary or permanent disabilities, depending on how long the brain lacks blood flow and which part was affected. They include the following. 1. Paralysis or loss of muscle movement, which usually happens on one side of the body, or loss of control of specific muscles like the face or one arm. 2. There may be difficulty talking or swallowing. A stroke affecting muscles in the mouth and throat may make it difficult to talk clearly, swallow, or eat. There may also be difficulty with language, including speaking or understanding speech, reading, or writing. Third, there may be memory loss or difficulty thinking, reasoning, making judgments, and understanding concepts. Fourth are emotional problems, like emotional lability or depression. Fifth is pain, numbness, or other unusual sensation that may occur in the parts of the body affected by the stroke. And lastly, changes in behavior and self-care ability. Patient may become more withdrawn and may need help with grooming and daily chores. Now, how do you prevent stroke? Many stroke prevention strategies are the same as strategies to prevent heart disease. In general, healthy lifestyle recommendations include the following. 1. Control hypertension. This is the single most important thing to do. Second, lower blood cholesterol. Eating less cholesterol and fat, especially saturated fat and trans fats, may reduce atherosclerosis. Statins and other cholesterol-lowering medications may also be prescribed. 3 is to quit tobacco use. 4. Manage diabetes. Diet, exercise, and losing weight can help keep blood sugar in a healthy range. Anti-diabetic medications like metformin and glipizide may also be prescribed. 5. Maintain a healthy weight. Being overweight contributes to other stroke risk factors such as hypertension, cardiovascular disease, and diabetes. 6. Eat a diet rich in fruits and vegetables. 7. Exercise regularly. Aerobic exercise reduces risk by lowering blood pressure, increasing levels of good cholesterol, and improving the overall health of blood vessels and the heart. It also helps to lose weight, control diabetes, and reduce stress. 8. Drink alcohol in moderation, if at all. Heavy alcohol consumption increases risk of high blood pressure, ischemic strokes, and hemorrhagic stroke. 9. Treat obstructive sleep apnea. Obstructive sleep apnea is associated with obesity and hypertension. And lastly, avoid using illegal drugs. Certain street drugs such as cocaine and methamphetamine are established risk factors for transient ischemic attack or stroke. Preventive medications are given after an ischemic stroke or TIA to help reduce the risk of having another stroke. They include antiplatelet drugs and anticoagulants. The most common antiplatelet medication is aspirin. After a TIA or minor stroke, aspirin and the antiplatelet drug clopidogrel may be prescribed for a period of time to reduce the risk of another stroke. Now, anticoagulants are drugs that reduce blood clotting. Heparin is fast-acting and may be used short-term in the hospital. Meanwhile, warfarin is lower-acting and may be used over a longer time. It is a powerful blood-thinning drug and needs to be taken exactly as directed and regularly monitored for side effects using blood tests. Lastly, newer anticoagulants include dabigatran, rivaroxaban, apixaban, and edoxaban. They're shorter acting than warfarin and usually don't require regular blood tests or monitoring and are also associated with a lower risk of bleeding complications. So, how do we diagnose strokes? The first step is to determine the type of stroke, which usually requires a CT scan or an MRI. We also need to rule out other possible causes like a brain tumor or a drug reaction. Examination should include 1. A physical exam including a full neurologic exam. 2. Blood tests, which includes blood coagulation tests like bleeding time and clotting time, blood sugar for diabetes, and complete blood count. 3. Computed tomography or CT scan, which can show bleeding in the brain, an ischemic stroke, a tumor, or other conditions. A dye may be injected to visualize the cerebral blood vessels and blood flow better. It's called computed tomography angiography or CTA. 4. Magnetic resonance imaging or MRI, which can detect brain tissue damage by an ischemic stroke and brain hemorrhage. A dye may also be injected to visualize cerebral blood vessels and blood flow better. It's called magnetic resonance angiography or magnetic resonance venography. 5 is carotid ultrasound, which may show buildup of fatty deposits or plaques and blood flow in the carotid arteries. 6 is cerebral angiogram. Although rarely used, This procedure gives a detailed view of arteries in the brain and neck. And lastly, echocardiograms can find the source of clots in the heart that may have embolized the brain and caused the stroke. Now let's go to treatment. Emergency treatment for stroke depends on whether it's an ischemic stroke or a hemorrhagic stroke. In ischemic stroke, blood flow must be quickly restored to the brain. First, emergency IV medication must be given with drugs to break up a clot, and this has to be given within 4.5 hours when symptoms first started. The sooner these drugs are given, the better. Quick treatment improves chances of survival and reduces complications. An intravenous injection of recombinant tissue plasminogen activator or TPA, also known as alteplase, is the gold standard treatment for ischemic stroke. The drug restores blood flow by dissolving the blood clot causing the stroke. Second is emergency endovascular procedure to treat ischemic stroke directly inside the blocked blood vessel and restore blood flow. This must also be performed as soon as possible. Third, medications may be delivered directly to the brain by inserting a catheter through the femoral artery and threading it to the brain to deliver TPA directly where the stroke is located. The time window for this treatment is somewhat longer than for injected TPA, but is still limited. Fourth, removing the clot with a stent retriever, which is particularly beneficial for people with large clots that can't be completely dissolved with TPA, and is often performed in combination with injected TPA. The time window when these procedures can be considered has been expanding due to newer imaging technology. Perfusion imaging tests using CT or MRI may be done to help determine the likelihood that someone can benefit from endovascular therapy. Now, other procedures that decrease the risk of a re-stroke is carotid end arterectomy and angioplasty and stents. Now, carotid end arterectomy is a surgical procedure that removes the plaque blocking the carotid artery and may reduce the risk of ischemic stroke. It involves risks, especially for people with heart disease or other comorbidities. Second is angioplasty and stents. In an angioplasty, a surgeon threads a catheter to the carotid arteries via the femoral artery, and a balloon is then inflated to expand the narrowed artery. A stent can then be inserted to support the opened artery. In hemorrhagic stroke, emergency treatment focuses on controlling the bleeding and reducing pressure in the brain caused by the excess fluid. Emergency measures includes medications that lower intracranial pressure like mannitol, antihypertensives, antiepileptics like diazepam, and drugs that prevent cerebral vasospasm like calcium channel blockers and magnesium. Patients on anticoagulants may also be given drugs to counteract them, like vitamin K and protamine. Next, surgery may be used to remove large collection of blood and relieve pressure on the brain. It may also be used to repair blood vessel damages associated with hemorrhagic stroke, like an aneurysm, arteriovenous malformation or AVM, or other types of blood vessel abnormalities that cause the hemorrhagic stroke. Third is surgical clipping. A surgeon places a tiny clamp at the base of the aneurysm to stop blood flow to it. This clamp can keep the aneurysm from bursting, or it can keep an aneurysm that has recently hemorrhaged from bleeding again. Fourth is coiling or endovascular embolization. This is done by using a catheter inserted into the femoral artery and guided to the aneurysm, where tiny detachable coils are threaded in to fill it. This blocks blood flow to the aneurysm and causes blood to clot. Fifth is surgical removal of arteriovenous malformations or AVM. Surgeons may remove a smaller AVM if it's located in an accessible area of the brain and eliminates the risk of rupture and lowers the risk of hemorrhagic stroke. However, it's not always possible to remove an AVM if it's located deep within the brain, it's large, or its removal would cause too much damage on brain function. And lastly, stereotactic radiosurgery. Using multiple beams of highly focused radiation, stereotactic radiosurgery is an advanced, minimally invasive treatment used to repair blood vessel malformations. Lastly, let's talk about stroke recovery and rehabilitation. First, after emergency treatment, stroke care focuses on helping the patient recover as much function as possible and return to independent living. Second, the impact of a stroke depends on the area of the brain involved and the amount of tissue damaged. If the stroke affected the right side of the brain, movement and sensation on the left side of the body may be affected. If the stroke affected the left side of the brain, the movement and sensation on the right side of the body may be affected. Left brain damage may also cause speech and language disorder. Third, most stroke survivors go to a rehabilitation program and is based on age, overall health, and degree of disability from the stroke. It will take into consideration the patient's lifestyle, interests, and priorities, and the availability of family members or other caregivers. And lastly, every person's stroke recovery is different. This ends our discussion on cerebrovascular infarction or stroke. See you next time when we discuss transient ischemic attack or TIAs.